program for you all today. We're going to be speaking about different careers in the mental health field. So the goals here today are twofold. The first is if you don't know whether you want to be in the mental health field at all, this is a really good time to figure out what it's like to be a therapist, a day in the life of a therapist. The other one is, I'm sure a lot of you guys are thinking already that you want to go into the field, but there's so many different ways that you can go into the field, so many different degrees that you can get. And one of the most common questions is, what is the difference between all these degrees? What can I be doing? So we have an amazing group of panelists here for you today. They're all great role models. They're experts in their own respective fields. We have Ratzon, Robin, and Etty. Ratzon is a licensed mental health counselor. Dr. Etty Mizrahi has a PsyD, so she has a doctor of psychology, and Robin Shaul is a licensed clinical social worker. So they're all going to go through a little bit about what they do day to day, how they got their degrees, the different fields that you can work in, the different locations, the different types of clients that you can see, and then they've all come up with some extra tips to tell you about the field at large. So a few things before we start, just to let you know, at the end we're going to have time for Q&A. If you do have questions while the different panelists are speaking, we're going to wait to do all the questions at the end. So either you can make a note for yourself or you can write it in the chat. I'll be monitoring the chat and I can ask some of those questions out loud when we finish. So I'm going to pass the mic over to Ratzon, who's going to start you off. Thank you all for coming.
Hi, everybody. How are you? Hope everyone's doing okay. So my name, as Carol mentioned, is Ratzon Golian. I am a licensed mental health counselor, or LMHC, and I'm going to tell you a little bit about what I do and a day in my life and what I did to get to this point. So I'm going to start with what I do, and currently right now I'm doing probably too much, but what I am doing right now is I have a private practice, which is let's call it my afternoon evening job. I work with a lot of young adults, teenagers in my office. We work on all sorts of various issues. I see them for what we call therapy or counseling. I work with them. I work with their parents. Sometimes we work together. Sometimes, we work with a family, doing different things. So that's kind of my afternoon, evening sort of job. That's really what I would call my true passion, what I really love doing, and I really enjoy it. And that's my afternoon, evening. Along with that, I do a lot of parenting workshops where I help parents also understand teenagers. Not everyone really, a lot of parents may not be as effective as they can be. They're humans too. I know we sometimes don't believe that, but they are. And I help them be more effective and be more understanding and have help them build on their relationships with their teenagers and young adults. So I call that Tune Into Teens, and it's a popular workshop that a lot of parents attend. During the day, I work as a case manager in SBH, which is, I work with a lot of families that have financial crises, and they come into us and we help them manage their crises and kind of work with them to treatment plan to get them out of their situation and get them stable again. So there's a very strong element of psychology that's involved with that because, there's different mindsets and different things that go on that sometimes cause the problem or make the problem stay. So I help them plan and work on getting out of those situations. As well as I'm the intake coordinator, which means that any person, any family, or any person that's calling SBH for, in financial crisis, I'm the first person that kind of handles that. So I have to do an assessment of their financial issues and, the mental health state of the house and family dynamics. I'm doing a lot of different assessments and very, very quickly to be able to hand them off to the right teams and the right divisions and make sure they're getting the proper treatment and the proper care in SBH. So that's what I'm using my degree for right now. I know it's very varying because it's, financial. What does that have to do with psychology? And honestly, I never thought I would ever do that, case management sort of thing. But once I got involved, I loved it. It's a different type of work. It helps me stay fresh, kind of, not doing the same thing all day, every day. And those are my different roles. So let's talk about how I got to this point. So I started, actually, before even what's written on these slides, which is my schooling, I started as a tutor, believe it or not. Tutoring led to teaching, but then I realized I am not such a teacher, although I was very good at it, but teaching was not my thing. I love the connecting with the kids that I was teaching. And once I kind of realized that, I said, okay, I got to head towards, working with people. And I kind of veered off towards psychology. So after I got my undergrad, I had to go for my master's, which I did in Brooklyn College. As you see, the schooling, it says 2 full years in a master's program. That was in Brooklyn College's MHC program. Now you could do it in 2 full years in a program like Brooklyn College. There are some tracks that might give you a 3-year, it spaces it out a little bit more, so it's a little bit easier, but I just wanted to go full in right away. So I did that 2-year program. And within the 2nd year, you also have an internship as part of your requirements. So you have to do about 20 hours a week of internship during the 2nd year, where you're working on site, like a Bikur Cholim Counseling Center or Tikva at Ohel or Interborough. And that's part of the requirements for your schooling, which after you graduate, you can work, but you cannot work on your own. And that's when you get supervised. You have to work under someone else who has a license, and you have to get supervised by them, which means that they are kind of looking over your cases and making sure that you're dealing with the things correctly, and you're learning and you're growing for 3,000 hours. And which after you do those 3,000 hours, that's when you are now eligible to go take the LMHC, the licensing exam, which will allow you to work privately and on your own. So after you take that LMHC, CE, that exam, you can open a private practice, you can start supervising other therapists, and you have more options. A lot of jobs will only hire LMHCs, so it's very important to get that license in order to be able to really grow. So that's kind of the track I took to get there. I also happened to I did my internship in SBH, and then from my internship in SBH in the clinic, I became a supervisor, and I kind of grew in SBH, and then I went to a different division, which is the financial one, and I started my private practice. The question that I get a lot is, what can you do with an LMHC? Like, what are your options? If I get this degree, where can I work? What can I do with it? So as I said, you could continue staying in a clinic. You could do therapy in a clinic setting. You could work in a school as a guidance counselor. You could work in an adoption agency. You can do case management, although a lot of jobs will prefer social work type of students or degrees, but you can work in a social services agency like I am. You could do substance abuse. You could work in with senior citizens. You could work in senior homes and things like that. And most people with an LMHC, honestly, are doing the LMHC so they could do private work. So they could see people, whether it's individual therapy or group therapy, family therapy, marriage counseling, things like that. And why is that? Because the LMHC degree, this is something very important for you guys to know, is usually very clinically based. The majority of the classes are focused on teaching you how to work with people in a room, how to build those relationships, the different orientations of therapy, the different disorders that are out there, and how to work with them, and how to do proper assessments, whether it's a risk assessment or a family assessment, whatever it may be. That they very much focus on the foundations of working with people and helping you build the foundations of treating people's mental health concerns. So it's a very clinically based sort of degree. So if you know that you want to do clinical sort of work, you want to work with people, especially one-on-one, LMHC is kind of the track. I personally knew that that's what I love doing, and I knew for sure that that's what I wanted to do for that reason. And it gives you the opportunity because you could get the license and you can open your own office and work with people privately. Okay, Well, so some things that I kind of want to talk to you guys about is even after you get a degree in LMHC, it's very important to also, not just be a general therapist, which is fine. I mean, you can do that, but I would say the tip that I would give you guys is it doesn't really stop there. You should really continue to learn, continue to grow, pick an area that you really, really enjoy, whether it's a certain age that you enjoy working with or a certain type of disorder that you like working with. Pick something like that, learn about it, get the right certificates, and get the right background to be able to treat those people so that you can do the best job you can, that you can. And it's most, I feel like when you are passionate about something and you love something, you'll do well with it. So like I knew that I love the young adult teenager stage. I knew I love the parenting. I love, working with the schools and all that. So for me, it was a no-brainer. That's what I kind of chose to do. And that's how I got to where I am today. Another quick point that I want to make is, and I'm going to tie this in with the salaries piece, is a lot of people, want to know how much am I going to make doing this? Is it, financially, is it, can I provide for my family? Can I make money doing it? Will I not? The answer to that is it's actually very hard to answer, but generally the way it works is, as I said, if you're passionate about something, you'll do well with it. So if you love helping people, if you're very passionate, you find that people come to talk to you all the time and you're that person that everyone leans on and you enjoy it, then this is for you and you will do well with it. In the beginning, it's not a high paying sort of job. On average, it doesn't pay great compared to other master's degrees, especially before you have your license. But if you're willing to stick it out and you're willing to work hard and you're passionate about it, you could end up, doing well. A lot of people that are very passionate end up moving up. They have private practices, they have multiple jobs, and you could end up providing for your family. You will not be a millionaire by no stretch of the imagination, but you will, you will be able to make money. Just to give a number, I think the average salary, if you look it up, is about $45,000 for a graduating master's student. But in private practice, you can, depending on how much you're willing to work, you can have, you can make anywhere from 150 to 250 people charge. And, if you have a couple clients, you build yourself up and you build up your private practice, you could support your family and make ends meet. So my ending message to you guys is, if you love helping people, that's what I think the common ground is with a lot of the psychology sort of fields, is you got to love helping people. And if you do, you're in the right place. If people, you love hearing people's, things, you want to understand how people work, how they tick, this is for you. I hope that was helpful, and I'm going to pass it off now to Etty. Go ahead.
Okay. Hi, everyone. I see I'm unmuted. I hope everyone can hear me. Thank you, Ratzon. I especially loved your concluding message, but everything that you shared was well said. Thank you for that. So when we're thinking about a PsyD, we're talking about, like Carol introduced, a doctorate in psychology. I'm going to explain to you guys a little bit more about what that degree means and what it entails, but let's start with, what do I do on a day-to-day basis? Do remember that while I'm speaking, I'm focusing on the school aspect of working as a school psychologist, just because that right now is the majority of what I'm choosing to do with my degree. We'll talk about some other options in a minute. So what do? A lot of you see me either holed up in my office throughout the day or walking the halls or in the main office throughout the day. A large majority of what I do is individual work with students, one-on-one sessions. If you've ever been in the guidance office, and I hope that many of you have been, you'll see that it's a constantly revolving door. Thank God the guidance department in Flatbush is a very normative place to be. That means it's a pretty normal thing to go to guidance. There's not as much stigma as there might be in some other places. And so we do a lot of one-on-one work with our students. There's also at the same time a lot of collaboration with faculty and collaboration with parents. That means phone calls and meetings and conversations It's an interesting dance because, as all of you know, when we talk about guidance and we're talking about anything in the mental health field, Ratzon, Robin, and me, we're really emphasizing something called confidentiality. And that means the privacy of the information that you share with us is really sacred to us. And we hold it very sacred. So when we're talking about collaboration with faculty and parents, we're always remembering that the things that are being shared in our sessions are private, but that we do need to work with other people in our students' lives in order to optimize that student's experience and to make sure that they're having the best experience possible. Another big piece of what we do is programming. A lot of you know, like Parenting Your Breakfast, or we had a parent program on anxiety, or we have programs on bullying. We collaborate with SAFE a lot in making these programs. So guidance is often behind the scenes of many of these things. We're always trying to find the hot topics that are really important to address for our students and our parents and our teachers and bring those topics to the forefront. Lots of meetings. My calendar is full of meetings. I like to think of these meetings as collaboration, but also as systemic change, because when we're thinking about sitting in a room with the principals or with the teachers or with the teachers of class R, let's say, we're talking about how to make sure that the system that we have going, the system of Yeshivah Flatbush, is working as best as possible to service our main clients, which are our students. So that's what I mean when I say systemic change. I do a lot of supervision. Robin's going to talk about supervision a little bit at the end, but I supervise the guidance department. I supervise the people that are involved in providing test supports and academic supports to our students. And I also work very closely with SAFE, like I mentioned before. Crisis intervention, which has never been more true than now. What we're talking about when we're thinking about crisis, we're thinking about how do we reach out to the different people and the different categories of people associated with our Flatbush family to make sure that they're protected and to make sure that we're servicing them as much as possible. So that will mean reaching out to our students, reaching out to our teachers, and we're reaching out to our parents, and having those elements know that we, the guidance department, are available to all of you to make sure that we're able to give you any support that you might require. This requires a lot of staying calm in a moment that is certainly not calm. It requires a lot of quick thinking, being quick on our feet, brainstorming, coming together, thinking about ideas, what would work the best, what won't work, what should we do, what shouldn't we do, and making sure that we get those messages out there without bombarding people with too much information. So at a time like this, that's really what's happening behind the scenes. My last point on this topic is that really every day is different. I could walk into my day and the calendar looks one way, and then at the end, it totally I didn't end up keeping one meeting, and I was flying around doing one thing and another. So it really depends, and you need to have a lot of flexibility. Talking about now getting the degree. So like I told you guys, this is a doctorate. So it is a lot of school. After finishing college, I went to school. I actually did this in 7 years because I forgot to even mention that when we were prepping for this, but I got my master's in school psychology first, which took 3 years. And then I went for my doctorate, which took 4 more years. But if you go straight after college, you're looking at a minimum of 5 years of full-time schooling. A lot of people do it in 6. Because there's a school, there's internships, but there's also something called a dissertation. That's a huge research project that you have to write based on doing research with a specific population on a specific topic. So within that schooling, however long it takes, there are usually 2 externships, which are part-time. They're 2 to 3 days a week over a year. So usually in my program, it was 2 days a week in a school, 3 days a week in a more clinical setting. A clinical setting would be something like a hospital or a mental health clinic. And then there would also be an internship that was 1 full-time internship that was basically every work day, 5 days a week. So that was all during school. Now in the supervised work section, after you graduate, there's also something called, you have to accrue hours toward your licensure. So you can work when you're done, like Ratzon said, you can work when you're done your schooling, but if you want to be able to work and not be supervised on your work, then you need to complete 1,750 hours of work being supervised by a licensed psychologist. They sign off, they supervise you, they sign off on you, then you take something called a licensing exam, and then you're good to go, and you can call yourself a licensed psychologist. It takes a long time. Another thing that I didn't mention, that I forgot to mention on the slide, is something called fellowships. A lot of times psychologists choose to do something called a fellowship. That's basically like Ratzon was saying, like a specialty or niche in that goes beyond your internship, where you do it for another year or 2 years after your internship when you're working toward licensure, so you could specialize in something. So my fellowship happened to be at a pediatric cancer center, which was very different than where I'm working now, which just goes to show all the different variety of options I have available to me. And I learned a lot during that time, and I got hours toward my licensure. So what can you do with a PsyD? You're going to see, if you read down the list, I'm not going to repeat everything because you have the list in front of you, that the top 2 bullets are the most, I would say, unique to my degree, let's say, versus mental health counseling or social work. The rest we could pretty much all do depending on our training and depending on our applied experiences, like our internships and our fellowships. The first thing on the list is either psychoeducational evaluations or neuropsychological evaluations. To put it in a way that you guys would understand, it's like when you're going to get an IQ test to figure out how your mind works. Let's say you're having trouble in school, you're trying to figure out what's going on, you want to go for an IQ test, you also want to go for an achievement test to see what the different skills that you have are, what are your areas of strength, and what are your areas of vulnerability. That takes a really long time. It usually takes like 3 sessions, like 2-3 hours a session, and then like a whole bunch of hours to write something called an evaluation, which is a report. And that is something unique to psychology. And if I wanted, instead of working in school, I could set up a private practice and do these different evaluations. I choose not to because I love the pulse of a school. And I think that for me, private practice, if it wasn't combined with something else, might feel a little bit too lonely. I would want to do a little bit of a lot of different things. But evaluations are something that are unique to the PsyD, to the doctorate. There's also psychology research and teaching. It's so not my area, but you could go into academia, you could work in a college, you could do research on different topics, you could be a professor in a college or in a graduate school. That's definitely an option with my degree. I want to also take a minute to describe, some people ask the difference between a PsyD and a PhD. PsyD is a doctorate in psychology, PhD is a doctorate in philosophy. The PsyD, they both lead you to the same place. The PsyD is more applied. You're doing more applied work where you're working in the clinics and you're working in the hospitals and you're doing the therapy, versus a PhD training is more heavily focused on research. And again, like I said, not exactly my area, not my love, not my passion. So I chose the PsyD. If I could leave you with my takeaway tips. My takeaway tips are: expect the unexpected. Flexibility is key. Like I was saying before, I walk into one day, I don't know what's going to happen, and I have to be flexible. I have to roll with it. It's not so easy for someone like me who's very structured, and I want things to be just so, and I want them to go the way that I planned them. But I've learned over the years that with mental health, especially when you're working in a place like a school or a hospital, things are moving all the time, and energy could be very high energy levels. And you have to know, you got to take it day by day and roll with it. If I leave you with nothing, I leave you with this. And I think this goes across professions that we're talking about here, but also across professions anywhere. Relationships are so important. It's important when you're thinking about networking, when you're thinking about going to a meeting or going to an event or seeing people and meeting people, putting on a smile, greeting them, engaging in conversation, showing them that you're listening, showing them that you care. But I extend that to the everyday, being a good colleague, being a good listener, being a good friend at work. I think, you know, when we have interns that we supervise in the guidance department, we try really hard to teach them that we hope the thing you learn the most here is how important it is to be a team player, how to be part of a team and work together, chip in, cover each other when we need help, and just always be that listening ear and problem solver for one another. And then my last tip is seek out every opportunity that you can. In high school and even in college, it's hard to find official opportunities in mental health, official opportunities in psychology, but anything could be framed as an opportunity. Think about being a counselor in camp, doing Big Brother, Big Sister through SBH, doing any chesed opportunities, any opportunities in which you're interacting with people. And like Ratzon said before, where you're helping people and engaging with people, those are where you're starting to practice your skills for listening, your skills for seeing what the other person might need from you, seeing how to respond to other people in a way that's going to be supportive to them. And then as the years go on, and if you choose to pursue one of these careers, you'll see that the world opens and there are a lot of opportunities as you go through the graduate level and then the postgraduate level. And my advice to you there would be go on every interview with a smile and enthusiasm. Don't like peg something and be like, oh my God, that's something I never ever want to do, because you never know. Like I always give this example. I thought that I wanted to work with 3 and 4-year-olds, and I laugh now because I was like scared of high school when I first started in this field. It was so not where I thought I would end up. And it took literally like a week of working with preschoolers in one of my earlier externships. And I was like, okay, not for me. So I learned it's not for me, which is just important as learning what is for me. But I didn't close the door to it. I still enjoyed something about the internship for the rest of the year, because there's something to be learned from everyone you meet, and there's something to be learned from everywhere in which you work. And whatever you do and however you carry yourself leaves an impression. And you always want to be building relationships and bridges with people so that you're remembered as you continue step by step in your profession. I hope I didn't go over time. Thank you for listening, and I'll be free to answer questions later. Thank you. And now
Thank
Robin,
you.
sorry, I was supposed to introduce Robin. Robin, our LCSW, waiting to hear from you.
Okay, I'm just waiting to come onto the screen.
You can go, Robin. You should be on.
Okay, can you guys see me? I see you, Carol. Yeah? Okay, wonderful. All right, thank you so much, Ratzon and Etty. That was really, really informative, even for me. The question of what the differences are between the different mental health professions has confused me as well until this day. So I'm happy that we're having this session. So my name is Robin Shaul. I am a licensed clinical social worker. Just as Etty and Ratzon, I'd like to share with you a bit of what my day-to-day looks like, as well as what it took for me to get here, and what options are available for social workers, and a couple of tips as well. So let's talk about what I do. So currently, I've got a private practice, which means that I am a psychotherapist, and I treat clients. I treat about 18 clients or so a week. So that's roughly 18 hours or so a week that I'm actually practicing. And I treat people individually. So I don't specialize in couples or family work. Although sometimes family members will come in and join for sessions here and there, because that can be really helpful. My focus is the individual, and I treat older adolescents and adults. I specialize, I would say, in a variety of areas. I don't like to pin myself down in terms of specialties, because I think that each human is unique and going to come with their own set of stuff that they want to work on. But I do specifically focus on trauma, people who've experienced traumatic symptoms from different situations, also anxiety. I really, really love helping people work on their own self-development and growth. It's not always necessarily something, and you learn this while you're in the field, that's like so tragic or terrible that needs to bring us into therapy. Sometimes it's just about stepping into that journey of self-growth, getting to know ourselves better, and having more opportunities of choice. And I also help those who are significant others, family members or friends of addicts, and I help them their own recovery from that as well. Just to give you a little bit of an idea of kind of what brought me to the private practice world, what came before that, prior to opening up a private practice, I was working at the SAFE clinic. So a lot of you are familiar with SAFE, probably from the school program. That's one facet, one department, but they also have a clinic as well where they treat addicts and their family members. And so I was there for about 12 years or so, and I functioned at various capacities, from an individual therapist to a group therapist to a family therapist. At one point, the last years that I was there, I was the clinical supervisor. And so I was supervising other clinicians and kind of helping to oversee and manage the cases there. That was awesome. I loved it. But eventually I felt like I wanted to have a little bit more independence. I was like ready to spread those wings. And that was when I started my private practice. So alongside the treating of clients, there are other things that this field entails. And for me, this is how it plays out. it's really, really important when you are a clinician, when you're a therapist, to be able to at times kind of step outside of your own perspective, right? So recognize that when I'm sitting in a room with a client, it's just me and them, right? And I'm coming in with my own ideas and my own self, and they're coming in with their own self. And I want to try my best to be able to have as broad a perspective as possible. And so in that process, it's really important to be a part of some sort of supervision. Etsy mentioned supervision before. She supervises other staff members within school. So what is supervision? Supervision is an opportunity to sit with somebody who may be a bit more experienced than you and who you trust, that can help you to do exactly that, to learn how to be a bit more objective and step outside of yourself. And so they might kind of call you on things of like, Robin, did you notice that your client is bringing in such and such? What do you think about that? So it kind of helps me to step back from my cases and take a look at it from a broader perspective so I can best help them. Even when I'm in supervision, my supervisor does not know who my clients are. We may like make up names or something like that to conceal their confidentiality, because confidentiality is really, really important. So I'm part of 2 monthly supervision groups. We meet over Zoom because we're just not all in the same place. I also attend individual supervision. I have somebody that I go and I meet with, I'm going to say about twice a month or so in terms of that. And in addition to that, and this is the really interesting thing, and I think something that kind of sets the mental health fields apart from other fields, I attend my own personal therapy. And that is because it's so, so, so important to be able to work on yourself alongside the work that you do. Lots of times clients can come in with pretty heavy stuff, and we need to learn how to contain ourselves, in the face of that, and ground ourselves. And also at the same time, sorry about that. At the same time, if I am, I need to be interested in my own self-growth journey in order to really appreciate and help the clients that come in. So that's what I do on a day-to-day basis. Let's talk about getting the LCSW degree. Okay, so it starts out with, first you've got to go to undergrad. So for all the degrees that we're talking about, you need to attend undergraduate school first. And once you graduate from there, I had gone to Brooklyn College for undergrad. Then you move on to getting to a master's program. It doesn't matter, which is really interesting, and I'm assuming it's still the same as when I was there, but it doesn't matter what you major in undergrad necessarily. I mean, I had people who majored in dance, and they still came to a social work graduate school afterward. It's helpful, but it's not necessarily necessary. So if you change your mind along the way in terms of undergrad, it's totally cool. But when I was in graduate school, you attend for 2 years full-time or 3 years part-time. I attended 3 years part-time because at the time I just started having children, and it was just more feasible for me as a mom to spread things out a bit more. And alongside the schooling, you have 2 years of internship to do as well. And you use that practice, the internship, in your school. So let's say you do something called process recordings, where you'll meet with the client as an intern, and then you write up what happens verbatim in the session, and then you bring that into school and you analyze it and break it apart and so forth. So it's a lot of hands-on learning. When it comes to this degree, I find that you really learn mostly hands-on. It's much more than, what you're going to be learning in the books. After you complete schooling, you need to take an LMSW exam and pass that LMSW exam. And followed by that, if you want to become an LCSW, if you want to become someone that's more focused in the clinical application, then that entails 2,000 clients contact hours under supervision in a minimum of 3 years. So I had accomplished that, I believe, also at SAFE. I was there as an LMSW, and eventually I accrued enough hours to be an LCSW. If you're just interested in getting an LMSW, then you don't need to go to that piece. And we'll talk more about it afterward. What can you do as an LMSW? So the field of social work is unique in the sense that there's a social justice and social advocacy focus. So when you're in school, you're not just going to have classes that are talking about how to become a therapist, what are the best ways to help people in that way, but also how can we help the world in general? Let's look at what it's like for people who are underprivileged perhaps, or not treated as equally as others. And let's see if we can develop plans for them to help them. So you have that focus on social advocacy. You've got everything else as well, that the Ratzon and Etsy shared, but the social advocacy piece is really, really crucial. With a social work license, with an LMSW, right? So that's before the LCSW. With an LMSW, you can practice psychotherapy under supervision. So you need to have somebody supervising you. That's where you'll most likely work in a clinic, and that's fine. You can also work for a social service agency. So what's a social service agency? Some examples of social service agencies that we've got in our community that are amazing is Sephardic Bikor Cholim and the Sephardic Community Center. So those are agencies that provide different types of social services to others. You could work in a social service agency doing things like community development or case management. You can also work for government agencies. You can work as a child protective service agent, where you get involved when there are families where the children are not being treated properly or cared for properly. You can work on benefit coordination, Medicare, Medicaid, things like that. You can also, and actually I did let's call it an externship, where I volunteered on my own in undergrad, working in a hospital setting because I wanted to get a sense for the field. But you can also work in a hospital setting where you focus on patient discharge plan coordination. What happens to these patients once they're discharged? How can we make sure that they get the proper care afterward? Okay. So we just spoke a little bit about an LMSW, right, which is taking it through graduate school and then taking your LMSW exam. Now let's talk about what happens with the LCSW. What does that get you to? And that's what I have. With an LCSW, you can do everything that an LMSW can do. In addition to that, and this is really the only component that stands out, is you could practice psychotherapy independently, right? So we call that the clinical route. So you're making a decision once you become an LCSW that most likely you would like to be a therapist, and you might one day want to be able to either open a private practice or be a supervisor of others. So that's what you can do with the LCSW. Some extra fun tips. So I have found that the field of social work, in addition to the other mental health fields, is a really incredible field that can help you to learn how to truly help others. So sometimes we want to be there for others, but we don't exactly know how, or like what really we think we know, but it's not necessarily what would be most helpful for them. These types of degrees help you to be able to get a broader scope and more of an understanding of individuals so that you can really help them. It's really an incredibly gratifying field, I find. I love to see my clients grow so much over the course of their work. It's almost like they're a different person and feel so much more comfortable with themselves. It's amazing. The other piece, and this is something that also for me stands out in this field, is that we are the tools that help our clients to grow and to heal. So in the same way that you may have a handyman who uses a hammer and a nail to fix something, those are their tools. The tools in the work here, one of the major tools is you as an individual. And so that being the case, it requires a lot of self-reflection and self-awareness to make sure that you keep that tool as sharp as possible. Something that's really, really important is to make sure that you're caring for yourself alongside, for two reasons. And one is, if we look at our famous Judaic saying of Ve'ahavta l'reacha kamocha, right? We need to be able to learn how to love ourselves first in order to love others, right? So we need to be able to learn how to care for ourselves before even conceptualizing caring for another person. It's really, really important. Also, therapists deal with lots of heavy duty stuff sometimes, and that can be difficult to hold on to. And in order to prevent things like burnout and such, we need to really make sure that we're taking care of ourselves. So making sure that we're allowing, time apart from the therapy room, like pursuing hobbies, making sure that you're socializing with others, and so forth. And finally, we look at, the idea of, you ever see those videos, those safety videos when you go on airplanes, and they always say when a mask comes down, make sure you put it on yourself before assisting others. It's the same concept, right? I can't help someone else put on a mask if I can't breathe myself, right? So again, we need to make sure that we're working on ourselves in order to help others. Finally, let's talk a little bit about boundaries. So boundaries are things that help us to learn and to delineate where we begin and ends, and the next person begins and ends, right? So we need to learn how to practice utilizing boundaries as mental health professionals. When I leave my office, I know that my day is over right now as a therapist, and I specify with clients, what are the in-between session, reach outs, what could they look like? What's cool for me, what's appropriate, and what we should leave for a session. So it's really important to do things like that. I'll say from personal experience, if you're going to work inside of our community, then you need to have even more thick, rigid boundaries than if you're going to work outside of the community. And why is that? Because when we're in areas where there is naturally less boundaries, right, because we're living next to people, we're interacting with them, we need to make sure we're implementing them further. When I was working at SAFE, what I found was I would go to weddings and see clients. I would go to, I would have family members who know my clients, and none of them could know any of that, obviously, because confidentiality is so, so important. And so I needed to make sure that those boundaries were really set. I'll tell clients, inside this room, we know each other. Outside of this room, you're just like any other person, right? So you may see that if I see you in a supermarket, I may not say hello if I wouldn't normally have said hello before you became my client, right? I'm going to wait for you. If you want to smile, we can smile at each other, but we want to make sure that we're maintaining our client space as well as our own. This is an incredible field. The mental health field is really, really so, so gratifying and challenging. But if you are interested, it's absolutely a path to try. And now we will open it up to some questions.
All right, thank you all. It was so, so interesting. I love the added extra tips at the end. I'm gonna let you guys all, either you can write it in the chat if you don't feel as comfortable, or else you all have the opportunity to unmute yourselves to be able to ask a question to one or all of the panelists. Thanks, Joyce. She said, I don't have a question, but I love that a lot.
I have a question. Oh wait, you can't see me. Wait, I have a question. How do you know if you have like a capacity for the mental health field? Like, how do you know if you can do it?
Such a good question.
Great question.
Anybody want to answer?
I don't mind trying.
Oh, go ahead, Roxanne.
Go ahead, Robin. Robin, go ahead.
I think that it's really important to immerse yourself in different experiences to get a sense of it. So you may want to, if you're interested in just trying out a little bit, like volunteer in different places, you can, Bikor Cholim has awesome opportunities of volunteer. You can, like I did, call up a hospital. I called up Methodist Hospital when I was in college, and I said, what volunteer opportunities do you have in the field of psychology? And they said, well, we have a music therapist here. Would you like to shadow him? And I said, sure. And that was my exposure. So exposure is really, really helpful and really important.
I would say also that if you think you're interested, you probably have the capacity. Like if you're a person who really loves helping people, people tell you you're a good listener, and you're a person that like reflects on your own self and like thinks about what you do and does things carefully, those are all really important ingredients.
Yeah, I would also add to that, that if you're a very good friend and your friends tell you like that you're a very good friend, you're loyal, you listen to them, you're sensitive to them, and as Robin also said, like, try out, try being a big brother or big sister, and seeing if that works for you. And if you see that you're doing well with it, then you kind of know you have the capacity to do it.
Right. Also, I think it's also important to realize, and this is not just for here, it's for any career that you think about entering or any schooling you think about entering. School's a long road here and any graduate level profession. So you're not married to anything. Like some people will start, I know somebody who started medical school, then realized, I don't think like physical health is for me. I think mental health is for me, and then switched to psychology. So there is room for trial and error, although hopefully we figure it out sooner rather than later. But there's room to figure things out as you go through school. And that's the only way for you to really see if this is what you love.
Yeah, that's a very good point. And also when you're in college, you're going to start going to psychology classes. If you start seeing that you love the psychology classes, that's also another indication that you kind of like this field a lot.
All right. Thanks, Natalie. We had another question. Adina, you wanna go for it?
Yeah, so my question is like, how do we shadow people if confidentiality is so important? Like, how do we get to sit in a room with a client?
It's hard. I struggle to answer that question. I don't think those formalized opportunities are really there till you're a little older. And that's, it's sort of a catch-22 because you're supposed to have experience, but then there's not so many opportunities to get experience. I think there are some places where you can shadow, not the therapy sessions, but you could sort of go along to certain meetings and things like that. Like even in Flatbush, we had undergraduate level, like college level interns once upon a time. They couldn't sit in a room unless a student agreed and gave permission, but at least they got some exposure to what the department did. So I think it's seeing whatever's out there and not being so picky about it in the beginning, because those opportunities will be hard to come by. Robin and Ratson, do you have any other like ideas for more formalized?
Yeah, it's definitely a problem to shadow people, the shadow therapists and people in the psychology field because of that. There are certain opportunities that do allow for some shadowing, or some of your own work. I know SBH had, we had like, let's say a junior captain program where we actually took young adults 18 to 25 and we put them on cases with a captain and a social worker, and they kind of like acted as a team player where they saw the social worker and captain in action trying to help families that were in need and talking to them. So they were able to get a little bit of a glimpse of what it might look like. So it is a little harder to find, but there are opportunities like that. You might find it sometimes more with children, seniors, that also might be a place to look. They're a little bit more flexible with those, with those demographics. Yeah, I agree. It's a hard thing to find though.
Can I make a suggestion as well? And you may laugh at this, but if you really want to get a sense of what happens in a clinical setting and in therapy, become a client.
Yeah.
Like choose something you want to work on and go for
That's
therapy to work on it.
Yep.
Right?
Great idea.
That's a very good idea.
I see Samantha has her hand raised if you want to ask your question.
Yeah, thank you. First, thank you all. That was really awesome.
Sure.
And another thing, so I am thinking about becoming a psychologist and maybe the PsyD route. So I'm going to ask a question. But also, I wanted to like get some kind of internship also in this field, and like I know that it's difficult. So I was speaking to Carol, shout out to Carol, who was helping me on my path. And she mentioned Pathfinders, which is like another great route because I got to like meet with students and like have that experience. So thank you. And Ms. Hannon, who's here, and Pathfinders in general.
We're happy to have you.
That's an awesome shout out, but also like that everything's an opportunity. It just goes back to what we said, and you have to be creative about it sometimes.
Yeah. Also, I have a question. So why would you choose like the PsyD route? Because it sounds like so much longer and like harder.
It is. It is. I don't know. I started with my master's and the in school psychology, and that allowed me to work in a school. But that was very limiting. It's much more limiting than social work or LMHC. So had I done something like I considered social work, and had I gone that route, that probably would have been awesome for me. I think the thing about PsyD is that the flexibility. I think really every door is open. Like, I think that we can all work in different places, but it's maybe like easy with this degree to be able to get into those places, but also the evaluation piece is that added specialty. So being able to read the evaluations and interpret them, and also to conduct them. And I will also speak to salary for a minute. The evaluation piece does command like a high fee. So if people do choose to work privately and do evals, you can make a decent amount, like a decent salary doing that. So I guess I just wanted like every option open to me, and I thought that this would be the best way to do it. And also, I love school and I love learning. So for me, the schooling part didn't feel as much of a burden. But if somebody's not a student and not like gung-ho, then it probably wouldn't be the smartest option.
Okay, thank you.
You're welcome.
Ratzon, the Lou sisters want to know how long it took you to get your license.
So
that's a lot of
my
hours.
license. You mean from when I graduated? From when I graduated grad school? So it took me, let me think for a second. I did it very quickly. I'm a very hard worker. So I had close to 45 clients in the clinic, and I was working Sundays and nights. I was working also on the side with my other private sort of work while I was doing that. So I ended up doing it in about 2 years. About 2 years it took me.
That's crazy that 2 is the fastest.
Yeah, because it's 3,000 hours, and some of that is supervision, but think about that, do the math. It's going to take you, it's going to take you about 2 years to plus you have to take the test, and studying for the test is also, it's not an easy test. About 40% of the people that take the LMHC test fail. So it just, it's a pretty difficult test. What?
That's hard to think about.
It is hard, but Etty, we didn't have to write a dissertation, so I think the trade-off is good.
It's all hard, but yeah.
Yeah. So yes, studying for that test is also, it takes a lot out of you, because it's not. Yeah, it's a very hard test, just to put it simply.
Yeah.
But that it's not hard that that you can't do it. It's impossible. It's just that I don't want to scare anyone off. It's just that test, and Carol you can attest to this also, is that there's a certain way that these people that made the test think. That's not necessarily the way when you go to your clinic and you do your internship and you do your hours. They're not, it's like lawyers sitting in some room somewhere that wrote this test. So you kind of have to think a little differently than what you typically are used to thinking in order to pass this test.
Yeah, it's an interesting format, but I actually think that it was useful. Like, they don't teach you really how to pass it in school, but it's cases. It's not just like multiple choice tests. So it's interesting, because it's like, you have this client, what do you do? Go. So it's
so cool.
Yeah.
And then on the test itself, like, if you get the answer right, they'll give you more information, and that will help you get further answers right. But if you miss that answer, then you can't get the further questions right, because you're missing information. It's like staggered in that way, and it's a little difficult, but it's doable. You just have to study for it the right way.
All right, so we're going to take 1 or 2 more questions. I know Danielle had a question. If anybody else does, just write in the chat that you have a question, or do the hand raising thing, just so we know. But Danielle, take it away.
So right now I'm in AP psychology, and it's something that I'm very interested in. Shout out to Carol.
Danielle, for being brilliant.
But I'm not exactly sure if I want to go into therapy or research or something, but I know that I do want to study it further in college. Do you think that it will help me in other fields? Like, let's say I want to become a lawyer or something else. Do you think psychology can help me out?
Absolutely. It's such a field. So it's like you can't find a better area to focus on that will help you to learn about people. And when are we not dealing with people? So I would say take psychology classes, go for it. It will definitely help you.
I think it'll also really help you tease apart if this is something that you do want to do. So, and some of the other fields don't necessarily have a major that you have to take, or, things like that. So it's a way to keep, I think, doors open.
And by the way, there are other fields that combine also with psychology. Like if you wanted to go into industrial psychology, if you like business, you can learn how to help people in the workplace and help workplaces function better.
Yeah.
So you can combine.
I want to throw out there also, there's a few tracks of masters also that we're not necessarily in those tracks, but there is a MFT, which is a marriage and family therapist. There is an art therapy, that there's an actual school that you get a degree in art therapy.
Right, like Miss Dayan, guys.
Yeah, so I mean, if you're interested in some of those things also, it's a little bit more limited. You can't get as many, because they're very specific sort of field that you're going into. But if you really love art and you love psychology, you could combine that. If you know you want to work with marriage and family, you can go for that too. So there are a few different tracks of master's programs.
Ratzon, you just reminded me of something that I wanted to say and I forgot while I was speaking, that one of the best ways to tease these things apart is to speak to people who've been through this, either through the process of like actually going to school in that, like for that degree, or like people that were contemplating different options. That's how I did it back in the day. And a lot of people call me and email me, probably the same for you guys, asking these kind of questions.
If anyone has questions about MAC, really feel free to reach out to me. I've helped about 15 people get into Brooklyn College's master program, and people that are just not sure about whether they want to do it or not, and they're already in college or whatever. I've helped people get into the Brooklyn College program specifically, or to just understand the MAC further. So I'm definitely open to helping, because I was where you guys were at some point, by the way. Just so you guys all know, I was where we all were there. And I remember how hard it was for me to kind of figure it out. And I wish I had someone telling me, hey, this is what this is and this is what that is. You guys have an excellent team in Flatbush that's really giving you that opportunity to do that. And it took me, big hand to you guys, really amazing. And so I made a commitment that when I'm there, when I reach there, I will help anyone who really needs help to get into this field. It's an amazing field, as everyone else said. It really feels good. I feel like I never go to work really, because I love what I do. It's crazy. I'll finish work 1 a.m. sometimes, and I'm like, yes, that was the best day ever. And I'm like, am I crazy? Like, is there something wrong with me? I just said I worked till 1 a.m. and I'm like, wow, that was amazing. But you know what? When you love it and you are passionate about it, you don't feel like you're really working hard. And if you guys have the passion, pursue it. We need good people in this field. I will tell you right now, there people that have the skill and the passion come to this field, because there's a need for more good therapists. There's plenty of work that needs to be done, and they could always use more. So, and as I said before, I'm free to anyone who has questions. Really reach out.
Yes, so I put everybody's contact information in that file that was sent in the chat, so definitely download that before the chat disappears. We're going to take one more question, and then if you guys have any other questions, feel free to email any of the panelists. So Marcel, take it away.
Yeah, Marcel's question, right?
Yeah, how do you
separate?
Yeah,
how do you put aside your personal issues, right, when you're working in this field?
Yeah.
That's like, and Carol, I saw you wrote, love that, Marcel. That's like the $1 million question. That's such a wonderful question. The fact that you're even asking that question shows that like you're already thinking and having that self-reflection that we were talking about. That's one of like the key ingredients to working in this field. It's hard because a lot of times when we're working with clients, sometimes I sit with one of my students in school and I'm like, oh my God, me too. And this is exactly what I think, or I struggled with this also, and I also hated math or whatever. And those are not things that I'm going to share back, because the work that we're going to do with our clients is going to be to help them and about them, and our own issues or the things that we identify are not the things that are important to bring into the room. So the best way to cope with this, and the best way to make sure that we have those separations and have those boundaries that Robin was talking about, is doing a lot of self-reflection, doing a lot of supervision, whether it's with a supervisor who's more of an expert than we are, or peer supervision with other people sort of on our level. Something that Robin mentioned about therapy is really important. If there is something in particular that is a challenge or something that we're working through in our lives, it is really important to go and be in therapy ourselves, because you'll never know what it feels like to be on the other side of that desk or of that couch or whatever until you're in that spot, and there's nothing like it. So it is really important to work through those things. And put those things aside. And then another piece, another layer that I want to add is that a lot of people ask, like, how do you listen to such hard things all day long and such sad and heavy things and then like go home to your family and be okay? And I'm going to be honest, that's not easy either. That's sort of a different way of looking at this question. And it's also important to remember that you are here to help people and that you do care so much, but at the end of the day, you also have to be a person and take care of yourself and separate and also manage your own life. And I would say the key to all of this is just like reflecting and knowing yourself and recognizing these things as you go so that you can make sure to keep working on them.
Yeah, with the proper training and, and the right self-reflection and self-awareness, you really learn how to manage that piece. It is a struggle in the beginning. So an excellent question. And it doesn't mean that we're perfect when you're a therapist. It doesn't mean that you do everything perfectly at all or you're a perfect human being. It's just that, as Etty said, is that you know that there's that there's you and there's the other person. You're putting yourself aside for a second and you're there for the other person and you're there to help the other person. And with the right training and the experience, you eventually learn how to do that. And you understand that you're not going to be able to fix everybody's problems, and it's okay. And it's okay. We're here to help. You don't always have to fix everything that everyone comes in with. So you end up learning the right balance of where am I and where's the people that I'm working with.
I see Jeannie also asked a great question in the chat. Should I read it out? She said, I know sometimes when you are a therapist, you just have to listen and you're not allowed to give advice back. Is that accurate? I love that question. Ratzon or Robin, you wanna take it, or I could talk about it.
I would love to talk about that as well. That's such a great question. Our roles as therapists is to help our clients, to help empower our clients to be able to make healthy decisions for themselves. It's not about, if we were to give them the answers, they won't develop that, right? We want to help them to develop the muscles of self-reflection, self-awareness, and making healthy choices. So that's why we don't necessarily tend toward giving like outright advice that often. Sometimes we need to. Sometimes we need to call our clients on things, or it can be helpful, but you need to find the right balance so that you're not disempowering your clients.
I like to frame it as like, we can talk and we can problem solve, and you're going to look to me to tell you what to do, but I'm never going to tell you what to do. We could just walk through together, and I might guide by asking questions and helping you problem solve, but all I'm doing there is to just really try to guide you to what you think and what you know, or hopefully know, is the right thing for you. So I look at it more like guiding. That helps. Sorry for the background noise. I'm muted.
Okay. Thank you guys so much. I know we went a little bit over time, but I appreciate you all sticking around. If you have any further questions, please feel free to reach out to any of the panelists, and enjoy the rest of your night. It was good seeing you.
Bye, guys.
Thank you so much, everyone. Pathfinders is awesome.
course.
Thank you, guys.
Take care. Bye.
Thank you.
Bye-bye.
Take care.